Hi, this is Dr. Sanjay from Call Doctor. This is our series of live session. Today we'll be discussing about asthma. And why asthma? Because asthma is very common. People know about it. But the point of discussion of this asthma is not about you don't know or what is asthma. You know a lot of it. The main point of discussion, because when I'm in my day-to-day practice, I've come across a lot of people of asthma, but most of them, not most of them, say maybe around 30-40% of people are not using their medication properly and they are not on follow-up. So what I found out that most of them are using the wrong medicine or inadequate medication. So what it lead to more frequent visit to the hospital and all. So we'll briefly discuss what is asthma and what is how they diagnose, how what is the treatment protocols available, okay, and as a patient or as a parent, how can you understand what is your level of asthma and how can you get better result in the sense of your symptom control is better and what doctor want from you and what you should expect from your treatment of asthma. And like it not like just having inhaler, and it is most important is what point of asthma control is, so that your day-to-day life is easier. So we'll start with the brief. First thing is what is asthma. As everybody know, asthma is basically your upper lower respiratory disease in which your airway become little sensitive to different things, so it constrict the airways, cause constriction and cause difficulty in breathing, sometimes coughing and wheezing kind of thing. See, and there are many causes can be there for this coughing and wheezing. There and sometimes patient like some, especially in children, they don't have cough or wheeze. They present sometimes like recurrent history of chest infection or bronchitis. And sometimes, especially I know somebody who has what we call exercise-induced asthma. See, when he plays, after some time of 10-15 minutes, he starts feeling breathing difficulty or chest tightness in the chest. But normally we were thinking that it is just because he plays vigorously and that's why his cough is like this. But that's not the truth. So basically sometime whatever we are not properly understood what is the problem, and sometimes we visited with that person to the hospital, ENT doctor, just thinking about it just because of normal cold and cough, but it was exercise-induced asthma. So that is one thing. That asthma is basically airway reactive disease. Your respiratory tract become little sensitive to the different kind of allergen or sensitive to sometimes different things, and you feel cough, breathing difficulty, and sometimes night-time cough or difficulty. So what are the risk factors? Like, who are the people who are more risk at getting this kind of asthma? Asthma, basically, you must be knowing that there are a lot of people who have allergy kind of problem. They are one. If there is a family history of asthma related to allergy, that's our second thing. Sometimes people with a premature or low birth weight baby, smoking. And then comes what are the things which can trigger your asthma. One is like tobacco smoke, dust mite. Dust mite means in a household there are a lot of small house dust, there are small bugs which can trigger your asthma. Air pollution, everybody knows, especially people from Delhi, they know whenever there is winter, because of lot of pollution, they get more severe attack of asthma. Sometimes I've seen people with pets, like dogs, birds, they can be triggered asthma. And sometimes some chemicals like cleaning and disinfectant chemicals can also trigger asthma. And sometimes the asthma can be precipitated by your cold and cough and flu kind of thing can be precipitate your asthma. Sometimes I experience sometimes people with a sudden cold air or cold atmosphere, they get asthma more. And sometimes stress can also produce asthma. So I know you understand what is asthma, because basically they're a little, your airway is sensitive and you get tightness in the chest because of constriction of your respiratory tract, you feel cough, breathing difficulty and different allergen. So how to diagnose that you are having asthma or it's just a normal cough? So doctor, what do? They call their procedure, the test called spirometry or peak flow meter. In spirometry, what they do, there is a machine, they ask you to blow into it and they see the pattern of the airflow which comes out of your air. Basically, what happened? It shows how rapidly you are able to remove air from your lung. Because as we know, as I discussed before, in asthma there is a tightness in the chest. Your respiratory tract are little constricted. So you can understand when the airway is small or when you see on the road, when there is narrow road, it takes more time to get out of it so that they can come to know. And after that, they may give you medicine to confirm this narrowing is responding to the medicine normally there which is prescribed. So it's called spirometry. They get an obstructive pattern. There are other reasons also for this pattern, but this is one other thing. And another way is called peak flow meter. Peak flow meter is basically they ask you to blow into a small, which we can use at home also, keep it to monitor your treatment and the response of treatment. Is everybody getting me? Okay. Any question? Okay. So that's the way we spirometry and peak flow meter. There are other tests called bronchoprovocation. They give you some medicine and see there is a constriction. Sometimes there's called nitrous oxide, inhalation, exhalation chart things. This is what they do, diagnose. So what is management? See, our point of discussion, the most important is asthma. Why is my important for me to understand is people have asthma. Sometimes they don't know what level of asthma they have. So according to this Asthma Society, they classify asthma in different categories. So why they classify into different category, what are the criteria of that is, and how it helps me as a patient, that is more important. It can be important from a doctor point of view to treatment, but for me as a patient is very important to understand, because sometimes we just go to doctor once, we go on 6 months back once, and then we never go back to understand why I see one patient. She came to me for tightness of the chest for a long. We said she was too tight. We given nebulization and the inhaler kind of medicine for her, and she got better. Then I asked, "How long are you having asthma?" She said, "I am having asthma." How is your asthma? She said, "It's control." How frequently you use? He said, "Whenever, sometime it needed." So then she came after 2 days back again. What happened? You said you use hardly this inhaler, but tell me exactly how frequently. She said, then I'm using 10 times a day. See, she's just using one inhaler called Ventolin for 10 times a day, which is not, and she's not using any medication because she gone to the doctor 2 years back. She was prescribed that medicine and she thinks this is the last medicine. This is because everybody says this is a blue inhaler, you take, that is all. So that's why if you're getting problem, you need to go to the doctor and you need to understand your asthma, and when you say it's controlled. So according to the doctors, like Asthma Society, they divided into asthma into 4, called intermittent asthma, mild asthma, moderate and severe. For us, as I said, why are you talking about in technical term? So basically I want to simplify, you understand what is different category. And main point is not about doctor, this is Facebook and Instagram, it is for the people. So ask yourself 3 questions. How frequently I'm having symptom? So that one, how frequently mean? If my symptom of asthma, some people have a wheezing, some people have a cough, sometimes have a breathing difficulty. If any one of these symptoms, which is whatever your prominent symptom of asthma is, how frequent? That means one is once a week or less than once a week. If your symptom is less than once a week, that means it happened 10 days, once in 10 days or 15 days or 20 days. That means your asthma is intermittent. So and your daily activity if not compromised, that means, and you don't have any nocturnal symptom like that in the night you don't have to get up for breathing problem at night, that means your asthma is intermittent. So there are two things to add. How many frequent once in a week, and I'm getting in how frequently in the night. If these are more than less, hardly not even in a once in a week, and once in a month in the night, that means you are intermittent. So what kind of medicine to be used is, I'll discuss. First understand this first question. Weekly or daily. If it is less, not even once a week, it's intermittent. If it is more than once in a week, but less than not every day, that means you are mild. But and you're getting only maybe 1 or 2 times in the night, then it is mild. So you need different kind of medicine. If your asthma is daily and you're getting up more than once in a week in the night, that means your is moderate. And severe means you're getting every day and you have almost every day or frequent nighttime symptom, that means your asthma is severe. So how it helped me as a patient to understand my degree of asthma. So ask your question when his doctor has given me medicine first time or second time. I'm getting symptom weekly or once or daily or night symptom or in a month or this, and my daily activity. These 3 questions: weekly, daily or monthly symptom. Suppose my symptoms only weekly or maybe once in a week. So the doctor once medicine may be enough. If my symptom is almost more than once in a week, that means I need something more. So, and that when you go to the doctor, you will be telling him, doctor, how frequently I need to use my reliever medicine. So he can upgrade or downgrade your treatment depending on your upon your symptoms, which is very important. This is the most frequent thing people are come across. I've come to see. They are not able to understand what level of problem I have. So that is my reason. Understand your asthma. It's not about doctor will be able to help you better only if you know what asthma I have. What level of, shall I go to doctor? No, and see, if your asthma is like less than maybe once in 10 days, once in 15 days, and you're having tightness, coughing or breathing difficulty, maybe your blue inhaler is enough. But if it is maybe less than more than once in a week, they need to add some medication, which we call steroids. And see, whenever somebody says steroid, people have a notion, oh, steroid, it's harmful. See, everything is harmful, excess of everything is harmful, you everybody know. So, but the amount of steroid which is being used in asthma is very, very, very minimal. It's in micrograms. And it has to be inhaled. Okay. So that's why don't worry. Obviously, misuse of anything can cause. That's why we said every 2 months, 3 months, you need to follow up with the doctor so that they can, if you're getting better with a small dose, or they can reduce it. If not getting better with a small dose, they can increase the dose. So that is the only point. So, and it's not only sometime when the doctor gives you, I said, somebody may say, so doctor, I am taking steroid also, inhaler also, I'm taking blue inhaler also, even that I'm using blue inhaler a lot. So we have as a doctor lot more to offer to you. So just don't think that we cannot. See, we have to give you treatment one by one because we want to have minimum side effect and the maximum benefit to the patient. If you follow up with us, like our aim is to make your life easier. So there are other medicine called, you must have heard of, there are tablets, and there are other medication like sometime you need oral steroid, the Montelukast you must have heard, which control in stabilizing your lungs. And why is so important that we need to control our asthma symptom? See, it's very, very important because see, what will happen if I control my symptoms? What is my indicator of controlling my asthma? See, when my asthma is controlled, I will be living my life normal. I will not feel any tightness. I will not have cough when I work or exercise. I will not feel any tiredness, fatigue. And this is one thing. Second thing, on the long term, because if you don't control your asthma, because you know the asthma is basically constriction of your airways, so it will become over the time too thick because of inflammation and all, which can cause over the time long-term chronic thickening of your muscle of the tract, and which will be difficult to treat. And I know I've seen one or two patients. Sometimes it's very difficult to treat these kind of patients. So where we talk about right now, asthma. What is asthma? What can trigger it? And how can I grade what my level of my asthma is? My asthma is like mild, intermittent, moderate, or severe, and doctor needs steroid or something like that. There are other things also available. The most see why we need, because there are out of 10 people of asthma, why we need to control. There are out of 10 people of asthma, maybe 1 or 2% need to, or like 10% of people need to go to hospital. So why we revise asthma, we talk about it, we talk about pollution control is so that we want you to not to come to the hospital, because this inhaler which we use are very fantastic medicine, which looks very small, but they are they are magic. Because I've seen in front of me, because I know people who have 1 or 2 puff or whatever required dose, change suddenly symptoms, and then you feel perfect, and like then you feel the difference. I've seen the difference in people. So that is one thing we talked about. What is asthma? What triggers? What is the level of asthma? So you have to know when I'm doing well. There are different methods people use, or as a different countries people use to educate people. They use what you call red light sign, red, green, or red, green, and yellow. Green sign meant when you say that I'm fine, I just continue, I don't need to go visit. When I don't have cough, I'm doing usual things and all, and my peak flow that I told you which can be used. Okay, sorry, I just got a call. This is about asthma and alert. Suppose you're not getting relief with your medicine, and you're getting lot of trouble in breathing. And like if you took inhaler 2-3 times and it's not helping and you're feeling tightness, this is not good sign. You should contact the emergency or call the ambulance and go to the hospital. This is the medication. What you can do as a non-medication, you should stop smoking, try to reduce weight, and try to avoid allergen which is causing you. Like suppose you find out it's because of your cats or because of some pollens, you can avoid these things. And there are sometimes they are desensitizing treatment are also that has to be done under doctor guidance. And nowadays, sometimes people ask me one more question, doctor, before like last 2 years when there was a lot of COVID, so they were concerned that during the COVID, do you need to continue my steroids? Because some people say my COVID will become worse or this. No. As per guideline till now, which we observe, there is no problem. Even if you have in COVID, you can continue on with steroid because the amount of steroid being used is very, very less. Okay. So I think I've finished about what is asthma and talk about how to diagnose, what to do, what is the treatment. The most important thing from my point of view is always educating patient about what is their level of asthma and they should follow. Sometimes people are saying I'm using steroid for 3 months, 6 months, what should I do? If you're symptom free for a few months, you should go and see your doctor. He may reduce your medication. Okay? Anything else? Anyone you want to know? Shall I finish? Thank you very much for attending with us.